Hi. Hi there. I hope I'm live. How can I tell if I'm live? Oh, there we go. Great. Hi, I'm Terry Myckatyn, West County Plastic Surgeons, Washington University here in St. Louis. And today we have a Facebook Live where we're going to be discussing um, body contouring after massive weight loss. This will be about a 12 to 15-minute long session, and I'm glad to see those who are joining me live here today. And of course, if you're watching this later on, welcome as well. So I think today we'll just kind of answer any questions. So I'm looking to see if there's any questions as we go along, any messages, and I'll try to address those if I see them. And then beyond that, I'm going to give you an overview of body contouring as after massive weight loss. So and I can see some people chiming in now, so welcome. So essentially, with body contouring after massive weight loss, there are numerous considerations. So the first thing is, we're evaluating how much somebody has lost, how they've lost that weight, how long ago they lost the weight, and if they've been able to keep it off. So in terms of being a patient looking to see a plastic surgeon to contour, those are the types of things that we're going to want to know. We're going to want to know if you've reached your goal weight, how long you have been at that goal weight. We're also going to want to know, so in having, whether it be through diet and exercise or whether it be through a surgical procedure, if you have any nutritional deficiencies, if you need some sort of nutritional supplementation, because obviously before having any type of surgery, we're going to want you to be nutritionally sound, because weight loss surgery does involve the removal of lots of extra skin, so you do have to heal a lot of wounds, and as a result of that, we want to make sure that when healing, that you are doing that appropriately, and that you have enough nutritional building blocks to do that. So in general, when somebody has weight loss surgery, it's going to take even a couple years, at least a year, to have lost the amount of weight that would kind of get them to their goal, and then several more months for them to maintain that. Folks who've lost the weight through diet and exercise, it typically takes a bit longer as well. So once that's all checked out and we know you've lost your weight and you've been able to hold it off for a while, we're going to ask a couple other questions. Things like what type of medical issues you may have, heart and lung, diabetes, the nutritional deficits, issues with thyroid, for example. We're going to want to know if you're a smoker or not. In general, we're not going to be doing any of these elective surgical procedures on smokers because it negatively impacts your wound healing and blood flow. So we're going to want you to quit. And typically that means quitting any nicotine product. So not just cigarette smoke, but also Juul, vaping, nicotine patches, Nicorette gum, chewing tobacco. Even in some cases, secondhand smoke can be a problem. So we definitely want you to have quit those things. And then in terms of making sure that you don't have any other health issues that may prevent you from having surgery, heart issues, blood pressure issues, for example. So we'll definitely want to get those checked out, improved to the best of your ability, and then often a clearance letter from a physician if need be. Also, if you're on some type of a blood thinner, we want to make sure that we can stop that for surgery so that your risk of bleeding is reduced. In addition, it should also be noted if somebody is diabetic before they lose weight, often just the act of losing weight can take care of many of those medical comorbidities. So often by the time we see people that have lost their weight, they're actually healthier than they were prior to the weight loss. So that's obviously a plus. In terms of the procedures that are most commonly performed, I like to kind of look at it in terms of what I consider the most high yield procedures. To me, that means those procedures that I think cause the most visible cosmetic and functional improvement. Um, amongst the different procedures. In general, that is going to be, in pretty much everybody, the trunk. So the abdomen and usually the flanks and often the trunk all the way around to the back. And what I mean by that is, in a photo, for example, those look the most dramatically better. When people gain weight and then they lose weight, essentially their skin suit is too big for their body. And that is one of the places that many folks have the most amount of loose skin. So removing all that skin really does have a pretty dramatic effect. So that is a high yield procedure, definitely. In women and in men, breast procedures can also be very dramatic in the improvement as well. So for women, oftentimes prior to weight loss, some women actually may even come in and talk about breast reduction surgery. And then they actually lose weight and the breasts do become considerably smaller, but there's still a lot of extra skin that remains. And so again, the skin suit of the breast is too much compared to the volume of the breast. And so in those cases, we are removing that extra skin. So the breast lift procedures do tend to have a fair number of scars. Those scars, which you can see on our website or in photos online, but essentially around the areola, a vertical scar below that, so that looks like a lollipop, if you will, and then typically a scar along the base of the breast, so that is often part of it as well. And then often with weight loss, in addition to the nipple dropping and the skin being excessive, there can also be a loss of volume. So some patients are totally cool with lifting up the nipple and just tightening up that skin, and that's what they're looking for, and that's great. Some patients want a little bit more fullness in the upper pole of the breast. And when the breast is really deflated after weight loss, we often can't really do that with just a breast lift, or not that effectively, because there's just not that much breast tissue to fill those spaces. And so instead of that, what we're doing is we actually are putting in a breast implant or sometimes a support structure to hold up the breast tissue or the breast tissue and implant. So while sometimes folks don't necessarily want a breast implant because they're not looking to be bigger, which we get, oftentimes though the breast implant can actually be used as a tool to improve shape of the breast. And then sometimes we'll also do what we call a so-called breast reduction augmentation, meaning that on the one hand, we're taking breast tissue out and tightening the skin from areas where you don't want it, such as below the nipple, and then we're adding volume to places where you may want more volume, which would be in the upper pole of the breast. So we're kind of removing from places you don't want it, adding to places you do. So that can be done as well. And then beyond that, in men, when we're dealing with the breast, often what can happen is the male chest tissue becomes loose and excessive. And similar to the other procedures, we're actually removing that extra skin. So typically that's going to end up being a scar along the base of the chest, sort of along where the chest muscle or pectoral muscle attaches to the chest. And then we're removing that nipple, and then we're replacing it back onto the chest skin. So that can be done as well. Now, beyond those procedures, which I think are probably the most high yield of the weight loss procedures, then other ones that I kind of consider, at least in the second tier, are going to be procedures of the arms and the face. So in the face, weight loss will lead to a more hollow appearance. Often there can be extra skin in and around the neck, in the along the jawline, in the jowl area. Sometimes a more hollow appearance in the central or mid face and around the eyelids as well. And those procedures, again, can vary depending on our evaluations. But for the neck lift procedures can be performed to try to tighten up some of that redundant skin. Often that is combined with a facelift procedure, so face and neck lift, in order to tighten up that skin of both. Typically, those scars are going to come sort of in front of the ear here, and then to address the neck, those scars can kind of curl here behind the ear as well. And then that's going to address a lax or a loose skin of the face as well as the neck. But what we have learned from years of experience with facelift surgery is that just tightening the skin by itself is typically not going to be enough. We also need to tighten the connective tissue of the face and also restore volume, because essentially that sort of hollow, drawn out look has developed to some extent from a loss of volume. So for that, we often will employ fat grafting, which is removing fat from elsewhere, and then injecting it essentially into the central face, into the nasolabial folds, in front of the jowl area, sometimes into the temples as well, where there can be hollowing. And your own fat is often used during surgery because we're there and we're already removing fat for other reasons, but you don't necessarily need to use fat to restore those volumes. There's other options. We can also use fillers. There's a whole host of fillers that have are sort of different indications, meaning that we use them in different places. They last a different amount of time and we sort of use them for different reasons. But you may have heard of these things like Restylane or Juvederm or Radius or Sculptra or Artefill or Bellafill or many others. And so these fillers can be used to restore some of that volume as well. And in fact, there's also the option sometimes for facial implants. So cheek implants, for example, chin implants, to try to restore some of that lost volume, or also to balance the facial skeleton to give a sort of a more contoured and youthful look. And then the next type of surgery would be doing procedures of the arms, and that can often be high yield as well. And in that type of procedure, often the skin of the arm can sort of be excessive, so there can be sort of some loose skin in that area. And so we can trim that loose skin out in order to improve the contour of the arm. It does typically lead to a longer scar. So it's a scar along the inseam or along the back part of the arm in order to tighten that up. That's called a brachyplasty or arm lift. These days, we are doing those procedures often with no drains. We often will combine that with liposuction. I'm going to take a pause. I'm seeing a question here, which is, are there non-surgical options to tighten neck skin? And so the answer to that is yes. So there are energy devices, which are essentially devices that use some form of energy, whether it be radio frequency energy or ultrasonic energy or lasers, to create heat and essentially tighten the collagen or the proteins in the skin. One that sort of has FDA approval is called Ultherapy, which uses sort of a focus sound or ultrasonic energy to achieve that, and that's done in the office. However, I will say that for folks who have lost a lot of weight, there can be a fair amount of excess skin. And so those non-invasive or non-surgical options to tighten the neck skin don't tend to be particularly effective. So what I would say is we tend to use those options in patients who have a modest amount of tight skin, either from sun exposure or age, and are looking just for a subtle improvement, who are trying to avoid surgery. But for folks who've lost a substantial amount of weight, in our experience, there is too much extra skin for those non-surgical devices to really change things very much. And so, our goal, of course, is to keep people happy. And so in most cases, I don't know that that would move the needle enough. Of course, every person has to be evaluated on a case-by-case basis. But generally, with significant weight loss, surgery is would be the gold standard. But yeah, there are lots of devices out there that I think I would argue make moderate, subtle to moderate improvements. And then the final area that I'll touch upon today is thigh lifts. So that is when the skin of the thighs becomes more redundant. There are different flavors of that as well. The scars could be within the groin crease or vertical along the inner seam of the thigh as being the more common ones. Those procedures tend to be the most effective when the thigh skin is already quite loose. Um, I'm mentioning these last a little bit because thigh lifts, in full transparency, are definitely the procedures that are associated with the most complications and the longest recovery in weight loss surgery. There's several reasons for that. From a hygiene perspective, because it's in the inner thigh and up in the groin, it's a harder area to kind of keep away from bacteria. It's also an area where there's a lot of movement. We walk, so that's part of it. Also, it is definitely more prone to swelling, both in the surgical site as well as further down the leg. And often when folks lose weight, they tend to lose weight more in the chest and in the trunk, and in many cases less so in the thigh. So we can't remove as much skin, and because of the complication profile for thigh lifts, we tend to be a little bit less aggressive to try to minimize the risk. But thigh lifts can be done, and certainly in folks who have lost a lot of weight and have quite a bit of loose skin, they can be really transformative and great operations. But I think anybody who's considering a thigh lift, needs to kind of think about their candidacy for it. Is there a lot of loose skin? And are they willing to kind of undergo the procedure knowing that there is a more likelihood of some bumps along the way, such as wound healing delays, infections, and swelling, compared to some of these other procedures that we talked about today. So if you're interested in exploring this further, we definitely recommend you see a board-certified plastic surgeon. Of course, we'd be happy to talk to you about this. And during that, you'd have an evaluation. We talked about all these things, such as how much weight did you lose, how long have you kept it off, any other medical issues, which areas would you like to consider, and then we could certainly do that. I'm just seeing one final question here, which is my frustration is that the insurance will cover the paniculectomy, but this will not help where my main issues are. An abdominoplasty will. The majority of my excess skin and where I get our upper abdomen and around the belly. Yeah, and I agree. So in general, insurance companies will cover paniculectomy procedures, which is that overhanging tissue. In rare instances, we've seen them cover some of the thigh lifts as well. But I would say that in the majority of cases, that is true, that the insurance companies typically do not cover most of these procedures. And so well over 90% of these procedures that we do are not covered by insurance. And that is sort of the circumstances of where we are right now with what's available in terms of insurance. All right, well, thank you very much. And should you like to discuss this with us at some point more, we'd be more than happy to see you. And hopefully this was informative for you. Thank you.